give the weight guidelines to Joe, but I would say a combination of cardiovascular and muscle strengthening exercises is the optimum. And there is evidence that actually muscle building can improve outcomes for patients and longevity, and cardiovascular on its own might not be the optimum. So a balance between the two is the optimum. Maybe Joe wants to answer the weight.
Okay, over to Joe quickly, and then we have another question.
I mean, essentially someone can be healthy at any size. It's more about their overall diet quality. I think that's probably the most important thing. But as a general guideline, you've got your BMI, but that's not always the most accurate measure of someone's health. I would normally be focusing rather on the number on the scale. I would be focusing on their physical function and their diet quality.
Thank you so much, Joe. Next question. Your name, please, and a question.
Yes. Sharif Ibrahim, physician. I'm just really comparing the services available in the US and the UK. I found that some interesting therapies are not available here, like insulin potentiated therapy, IPT, and things like use of fasting before and after chemo and radiotherapy. So is there any chance of having this really interesting, and I think there is a lot of evidence behind these treatments in the UK?
Yeah, they've got various different trials of looking at fasting at the moment. It's not something that I'd recommend to everybody. I have had patients who have been fasting before treatment have arrived, their electrolytes have been disturbed, treatment's been delayed, so it's certainly something that I'd blanket recommend to everybody. But I do have patients who have reported better, less side effects from treatment whilst they've been fasting. We don't know enough yet about what types of fast. So you've got water fast, so the day before, the day of, the day after treatment. Obviously, I would be quite concerned if it's not going to be right for everybody if they're not able to maintain their weight, or if their electrolytes are disturbed, or if they've got low blood sugar levels. But we also don't know whether maybe a reduced calorie diet may be of benefit compared to a total fast. I think it's a really interesting area, and I think there's going to be more research. I don't know if our nutritional scientists, do you know,
Sorry, I was going to ask a question or something else, but
I was going to say, have you got anything else to add about the fasting?
Fasting, there are small research studies showing that fasting can improve our metabolic health and also reduce the risk of chemotherapy side effects. But we need to do them in bigger studies with more than 100 people. And also, as Joe was saying, you need to look at overall health of the person. And again, like Joe had clients who have done crazy diets and have lost so much weight they can't go through chemotherapy. But and also going back to the fat question, there's no new evidence showing, especially if you can extrapolate from diabetes and metabolic health, that really we want to have breast cancer patients under a body fatness of 32%. So that's something that we're learning a little bit more about. So it's something to look at. So it's not necessarily your weight, because obviously you can have loads of muscle. So I'm like, yeah, I'm actually very muscular, but so all of those. Anyway, I was going to ask you another question.
Could we save it for later? Is that okay, darling? Thank you so much. Just one more question from this gentleman. Thank you, darling.
Thank you very much for I know time is. Growing up in England, I remember receiving bottles of milk delivered to the door. The use of dairy seemed to have really phased out and it's been demonized to some degree. C15, in terms of the deficiencies that we're now seeing as a new development, there seems to be also some link in terms of supplements or that treatment of breast cancer. Have you seen any knowledge of this link, C15 as a membrane protein? This is a nutrition question.
Yeah. I'm not aware of that specific element, but what I would say is that dairy has been demonized a lot, and maybe if we were in the Middle East or America, my advice may be slightly different if it was in the UK. But essentially, diet quality overall has declined, and that's more of a problem than any specific individual food. I would say, you know, dairy in moderation, absolutely safe to include in the diet and beneficial to include in the diet, but that you can also get the same nutrients from non-dairy sources. So it's very personalised, but I'm not aware of the C15.
So there is a study to show in American Journal of Clinical Nutrition that drinking milk can slightly increase your risk of breast cancer because it will not having but dairy actually reduces the risk of the World Cancer Research Fund. So if you eat cheese, yogurt, particularly fermented kefir, that reduces your risk, but drink a little bit of milk like dairy milk can increase your risk of breast cancer.
Amazing. Thank you. Joe just wants to say one more thing, then we need to move on. Thank you.
So I'm just going to add about the vitamin D deficiency that you mentioned, and I think it's very clear now that vitamin D is something that we should be checking, measuring for all patients, and I think it's really, really important, and advise specific diet or supplement.
Yeah. We're actually supplementing it, adding some vitamin D to our meal range that we're in.
Excellent.
Wonderful. Well, thank you guys. No more
It's
time.
not a question. He's talking about whole milk at the time. Now it's a different. It's pasteurized milk because the whole milk is different. Milk he was saying about giving to his dog. Many years ago might be more organic or whole milk because the milk now is, I don't know, it's different than pasteurized or
I mean, certainly raw milk is not safe. Don't anybody have raw milk.
No.
We want it to be pasteurized because that's safe. It's really about overall diet quality. People that have really high amounts of any one thing are probably going to be missing out on other things. We want to just be aiming, you know, it doesn't matter if it's organic versus non-organic. Studies have shown that there's no real difference in cancer incidence with organic versus non-organic.
Okay, thank you guys.
I would choose organic.